Just into our newsroom at 5, Tennessee Governor Bill Lee signed a major bill into law that changes the state's response to COVID-19. Here's some of the biggest parts. Schools have strict requirements on when they can issue a mask mandate. People who lost their job because they were unvaccinated are now eligible for unemployment. And it gives the state health commissioner power over local health departments when issuing public health guidelines. And on the topic of masks and children, barring a late court ruling effective Monday, mask requirements would not be required for any area public schools, overriding the current Shelby County Health Directive. Now, those at Le Bonheur Children's Hospital fear that fewer children masked up could also mean a surge in both cases and quarantines. Brad Broders continues our coverage tonight.
Whatever the rules are, we are going to continue to promote the wearing of masks in schools to families.
Le Bonheur Children's Hospital Dr. Sandy Arnold weighed in Friday, barring a court ruling. It was the last school day before Shelby County Public Schools will no longer be able to mandate mask wearing indoors in nearly all cases, based on state legislation signed into law by Governor Bill Lee.
I have several concerns. One is about kids getting sick. So we will certainly see an increase in spread within schools.
The chief of pediatric infectious diseases at Le Bonheur said the data is crystal clear about masking benefits with children.
We have literature that says that schools that enforce masking have fewer outbreaks of COVID-19 than schools that do not.
In Shelby County, total active pediatric COVID cases jumped 23% from last week to this week. That's why Dr. Arnold is concerned the winter months could be just as challenging for kids as the previous Delta surge.
This past summer, this surge really affected children, okay? So these kids, the hospital was full. We had multiple respiratory viruses circulating.
Dr. Arnold also worries any lifting of school mask mandates statewide will spur not only more COVID cases among children, but also less in-person learning.
If your kids are constantly getting sick, they're going to miss a lot of school because quarantine rules are still in place and they're going to have to get tested. You're going to miss work from them having to stay home.
Friday, SCS middle school parents were mixed.
We don't want that surge to happen, especially with the kids, because you don't know how it's going to affect the child because everybody is different. Not everybody is recovering from it.
I don't see a really big issue with it. But at the same time, if you know that, your child is not feeling well, then they should be kept at home because it's still out there.
I'm Brad Broders reporting.